All right, and our final speaker. Woo, I can't believe it. We're already down to number 10 here. It's Dr. Christopher Kim. He's an orthopedic surgeon at UHN's Schroeder Arthritis Institute. And when he's not in the operating room performing robotic knee replacements, he is in the lab designing cell therapies to treat osteoarthritis. And a fun fact about Dr. Kim, he is a black belt in Taekwondo. Don't mess with him. Whoa.
This is a picture of my late grandmother. She raised me. She's a huge Blue Jays fan. And every morning she would walk me to school. And when I was tired, she would take my backpack, and sometimes she would even give me a piggyback ride. And I didn't know it, but she was suffering from osteoarthritis. So when we came home, she would ask for a massage of her back. She would ask a massage of her knees. And she was truly living with osteoarthritis. And just as my colleague, Dr. Peruccio, told you about today, osteoarthritis is one of the major forms and common forms of arthritis. About 1 in 7 Canadians suffer and live with osteoarthritis. And the issue is that there's no cure. And that is why, because of my grandmother, and also because of the issues with the osteoarthritis, I decided to become a surgeon and also a scientist. So as a surgeon, I do knee replacements with robotic technology, and that allows me to be remarkably precise and accurate with our knee replacements. A knee replacement is kind of like resurfacing. We cut the bone, we take the arthritis away, and we make the knee joint smoother again, so patients are comfortable, they have no pain, and they can still live an active life. Knee replacements or joint replacements are life-changing. However, they're not for all patients. Many patients, unfortunately, even after knee replacement, are very unhappy that they had their surgery. Some patients even say, "Hey, Chris, I wish I never had this surgery. I wish I never met you." And that really hurts because we're trying our best to help patients. So what's happening in osteoarthritis? If you think of your knee like a smooth paved road, and the cartilage is the pavement, as time passes, you see small cracks, potholes form, and people complain of pain, stiffness, and a decreased chance of mobility. And one thing that we're able to do in the lab is to able to take cells and genetically edit them to express some type of target that we want to look at. So in our lab and at the Schroeder Arthritis Institute, we're able to take stem cells from a tissue like the bone marrow, and we're able to engineer them to either decrease a target that causes osteoarthritis or increase a target that protects cartilage. And you can see on the other side here is an example of a stem cell that is engineered. So when I think about my grandmother, I think about a time when she walks with me where she has no pain. A time where we can truly find a cure and be able to give her a time where there's no cracks, no potholes, and a smooth road ahead. Thank you.
Thanks very much, Chris. Now, I understand that you are the only surgeon, orthopedic surgeon, who is also a scientist in your division. So, being, I guess, a kind of unicorn in your division, tell me what those two roles, like how they complement each other.
First and foremost, you can't be a surgeon scientist without the support of your colleagues in the Division of Orthopedics, UHN, the Krembil Research Institute, and most importantly, the Schroeder Arthritis Institute. And so one thing that it really allows me to do, and I think which is really ideal, is that one day in the morning you can be in the operating room, right? And then in the afternoon, you can run to the lab, spend time with your lab members, and try to tackle osteoarthritis. And I think UHN truly allows a surgeon scientist to really excel in kind of those two areas. And so that's one of the true blessings to be here at UHN.
Great. All right. Thanks very much, Chris.
Thank you.
Christopher Kim.